Good morning. This is Dr. Bill Wyatt. I'm with the American Orthodontic Society, and we're going to talk a little bit more about intruding arches. But I'm a general dentist now that's been doing nothing but orthodontics for about 45 years. I did regular dentistry before that, and this idea of this intruding arch I came up with uh, back about 45 years ago. So we've been using it for a long time and have lectured on it all over the United States and a lot of foreign countries. And I'm going to kind of start in here. This is the uh, several cases that we've shown already on the intruding arch, and it'll be a very similar thing. So I'll run through it pretty fast. Uh, this is on a young lady who has a deep bite, pretty normal facial structure, so a pretty good vertical height of the face and everything. Just her chin is dropped back just slightly, but not bad. Now, but look at her teeth. She has this terrific deep bite, and so we're going to put intruding arches up here. Drop one, it'll come up like this on the upper, and it'll pick these teeth up. And down on the lower, it will be down here, and it'll come up and hook the lower anterior teeth and bring them down. Now this force that you pulls these up and these down pushes these up and pushes these down back here, and you'll increase the vertical dimension of the face. Unless you want to put a little pad in there, you can stop doing that, or you can just put up with, or maybe it'd be good to add a little vertical to the height of the face in here. We've gone through that on these other cases, and I don't want to take up the time if we don't need to. Okay, on this side, this is not a severe class 2. It's just a mild class 2 case, but it's still very deep. You don't see any teeth down in here at all. It's lapped over completely. All right, the upper teeth have some crowding, and the arch is a little bit narrow in here. I think we'll probably end up kind of widening it out a little bit as we develop this case. We can see what it looks like after we finish. Down on the bottom now, we've got some crowding, not a great deal of crowding, but when we lower these teeth down, we'll have more than enough room to get all these teeth in line. These teeth will be out in front of this when we get down here. In other words, they're torqued in now. They'll torque themselves out by actually expanding. From this, we'll band these second molars too during the case treatment. Here we are way on into treatment, and we've opened the bite and got everything lined up. So we went through the mechanics and the orthodontics of doing that, and we used those intruding wires on both lower and upper to do this case. So didn't get pictures of her intruding wires in place, but they were both there, and they cut 2 or 3 months off your treatment time. So we're way into the treatment. We used a little class 2 elastics. You see we got a hook here, and now we're pretty much class 1, you see, coming in. So the lower jaw comes forward real easy when you open the bite up. The lower jaw will come forward. In some cases, it'll come all the way. You won't even have to use any class 2 mechanics to finish the case out, but most of the time you got to use some class 2 mechanics, and you may have a little midline problem in some of these cases, so that's natural. Those are just regular orthodontic things that come up on nearly any case. But we've changed the torque of these teeth, you see. These are like these teeth were tucked in. I'll show you that on our models as we get further down in the case. Okay, it's coming along real good, and we're pretty close to lining the thing up and getting it finished. You can finish these cases because you can finish early because you start with everything the first day. You put the intruding wires on along with your little flexible wire, and you're way on down the line. You remember how crowded this was? This bicuspid was out here. It's already just lined up, and our arch form is much better now than it was when we started. If you remember how narrow it was, now we've got the 6 T's still in the brackets, and we'll bond a 3-to-3 retainer on the bottom. This is an upper wraparound retainer. We don't ever cross over the occlusion with the retainer wire. So this is an upper wraparound retainer, and it has a bite plate for sure on it underneath here. We can show that later on, and we'll bond this on back in the back and then take all this off. Normally now we go ahead and bond this before we even take the wire out here, so we're dead cinch that this stays exactly like we have it here at this point. Okay, now just looking at the side, but we've got a good class 1 interdigitation with the lower molar out in front of the upper molar as you go back through there. So let's see what, now on the other side, the same thing. This is going to turn out to be a very nice case. Okay, here's the upper retainer, and this is where she bites, right in there. She bites on that acrylic. If she wears that retainer, the bite cannot deepen again, and she'll wear it real good and keep from having her teeth like you saw there. Now the lower is lined up. We need to come in and bond this. I hope we did. Sometimes I try to depend on the bite plate to keep them in line, but I don't want to depend on that. It's not exactly straight right in here, so we got a little flaw in the thing. Now when you look at the model where the lower teeth were, they were right up against the mouth, right up here, and now they're quite a ways down. So we intruded these 6 lower anterior teeth doing this case. We got them out of the roof of the mouth, and as they go down, we torqued them out more. Now, you remember how the upper teeth were lined up nice and straight out here? You change the torque. So the root went in some, the crown came out some. We were crowded here, and we're not going to be crowded when you look at the upper teeth. They're not crowded. We could have trimmed this one just a little bit here because the gingival line is good. Made that look a little nicer up there, but we didn't. So we've taken the brackets off of there, and we finished the case like that. Now here are the cases showing the models and showing the teeth. This cuspid was moved back to here, and it is. It's back in that slot right there. This bi went back here. This one went back there, and this molar is back, and the bottom one is forward. In other words, the lower jaw came forward, and here this relationship changed in here. You can see that where these teeth are out along with that. This gives this lady a better looking chin as you finish the case up. In other words, this moved the whole blooming jaws come out here. This went back some, but not too much. We probably wore some class 2 elastics to finish it out just exactly like that. Look on the other side, the same thing. If you come out with a nice looking case, if you can just learn this long. And you keep these teeth, you bring them into contact, you probably expanded some back here, and these teeth are lined up better in the back. You can look back there too. So we don't want to take a great deal of time doing it, but we were crooked here and we didn't get completely lined up on these teeth. I'm sorry for that. Up above though, we're lined up real good, and here we were crowded. The arch form is bowed out more than you see that it is here. In other words, this is wider across the front up there. Now, let's see what, now here was her cephalometrics, and this was, her age was 38 and 1 month. And this was 12 of 88 right here when we did that. That's our first cephalometric picture we took. Now I hope I took another one. All right, we looked at the jaw joints. On one side, she was hitting like this. This is biting, this is relaxed, and this is open the mouth. Now, if you take these transcranials, you see what moves in here, and you can tell what actually is the condyle and where it is in the fossa. So when she bit down and when she relaxed her jaw, it wasn't very much. If I remember correctly, she didn't have any TMJ problem. Now the left side of the mouth, the jaw looks about the same, and those are some pretty darn good transcranial x-rays. So people who have jaw joint problems, now she may have had one, or we wouldn't have taken all this. I'm sorry. She probably had a jaw joint hurting. But after we opened her mouth and got it further forward, the jaw will be able to rest a little further to the anterior part. Now this is the first panorex. You see she's biting down here. The lower teeth are coming up to there. She had a weight of a tough wisdom tooth over here. I hope she got that out, because that's going to be bad. And I'm sure we recommended removing those wisdom teeth, and I hope we did, because that's going to give her some trouble if we didn't. Okay, she has, the wisdom teeth are gone, and this is finished up in the retainer. This tooth right here has got a root canal done on it. I don't think we had any. I know we didn't have anything to do with the root canal forming back there. Let me go back and see. No, she had the root canal. We started the case. And let me see now. Back on that. All right, here's one other in treatment. And here she is after we finished the treatment. Now, if you look at her profile here, it's straighter. Her chin is out some. In other words, it moved forward when we leveled the bite, opened it up where her jaw could come out further. And she's got a little bit more vertical height in the face, but she has a better chin. Now, that's not easy to get on a patient. You got a beautiful smile, and there her teeth are in 1995. That's several years later. It's deepened just a wee bit, and we were wearing the retainer wire stopped right here on this to keep these teeth in, and she seems to be doing quite well with it. And that's 95 again. It's holding in the class 1 relation. It was class 2, if you remember, and it's still class 1 in 1995. And I think that's as long as we watched the case. Everything up above looks about the same. You can tell this lady wears this retainer. You look up in the mouth and they've got a track in there, and maybe she wears it too much. This tissue looks like it's a little irritated. She probably should take it out a little more and brush the tissue up there to finish it up, to where you wear a retainer for years and years. She'll have to use that retainer, but she's glad to get them straightened up. Now the lower anterior is not perfect by a long shot, but it's not bad, and it's holding up good. That's 95 also. And here's another, I think that's a starting picture of her, but let me go back. Anyway, her jaw moved out on those. If we went back up to here, you see where her jaw is here. It's better than it is. This is after we finished. That other picture was back in before we started. You see the jaw's back here. Now when we open that up, her jaw moved out like that, and she's a better looking patient. So I'm gonna quit on this, and we'll line this up. We've got 6 videos on in the intruding wire here, so I hope you enjoy them, and I'm gonna